Again, on March the 12th, the Talbot County activated the COVID-19 Virtual Emergency Operations Center. The activation of the EOC brings together county and state agencies to coordinate our efforts to address the COVID-19 pandemic. The virtual EOC is not meant to create panic or fear, but just the opposite. The collaboration of these agencies is purposed to provide accurate, clear, and complete information to Talbot County citizens to keep everyone safe as possible as we weather this viral storm. It is unfortunately that I have to report that Talbot County has confirmed its first positive case of COVID-19. The patient presented at Shore Regional Hospital with symptoms. A test was performed, and the results did come back positive. We all send our thoughts and prayers to the patient and the family. Talbot County offices will be closed effective Tuesday, March the 17th. All healthy staff will be expected to report as scheduled. We are not reacting out of fear, but out of an abundance of caution, allowing our staff to take care of themselves and their family. Also, tomorrow I will be signing a declaration of state of emergency. This will effectively allow Talbot County to activate additional state and federal resources. Again, we stand shoulder to shoulder with the governor and his executive declaration. We're working with all of our partner agencies, the health department, the public schools, emergency services, Department of Social Services, and many other state and local agencies to make sure that we give clear, concise, and complete message to the citizens of Talbot County. We want to make sure that everyone stays safe. We want you to make sure that you're washing your hands thoroughly or using sanitizer, making sure that you're using disinfectant wipes around your work area and around your home. And just make sure that if you're feeling poorly, that you contact your physician to get in to see them as soon as possible. Again, we're not reacting out of fear, but out of an abundance of caution to make sure we give clear and concise messaging to our citizens. So with that, I'm going to pass it over now to Dr. Fredia Wadley, our health officer, for her comments.
As Councilman Pat mentioned, we've had our first COVID-19 case. This case is what we call a community transmission. It means it was not related to travel. It was related to contact with someone else that had the virus. That someone else wasn't even in this county, but this is our first case. And as we do that, and as we said in our plans, that makes us more cautious. And right now, the Talbot County Health Department are contacting any of those individuals that the infected person came in contact with to see if they have symptoms and to give them appropriate instructions. So as we have told you from the very beginning, we will keep you updated whenever we know we have a confirmed case, and we'll be posting this so everybody will have the information at the same time. At the same time, we also want to reiterate that, there's things you can do to take care of yourself and your family, and simply washing your hands and using these on surface tops, all of that we do to try to keep down the flu is the same thing that we're going to try to do to keep down COVID-19. So with that, I want to also turn it over to Clay and let him tell you sort of the structure that we've put together that will help us collectively respond to COVID-19.
In the United States of America, we have an emergency management system. That's an organization to respond to crisis. And whether it's a crisis from an advancing hurricane or hazardous chemical situation or an emerging infectious disease, what it does, it puts a system in place to optimize groups of people and allows them to work together toward common goals to ensure we do the right things in the right amount of time. Both the governor and the county council president have been clear. We're trying to strike a balance between overreacting and underreacting. We want to be reasonable and prudent. And the only way that we can be reasonable and prudent is if we're informed. So our goal is to make sure that as we activate the Emergency Operations Center here, and the county council and the county council president signs a local declaration of emergency, we will create a common operating picture for all those involved in our community in addressing this issue. We will clearly identify goals and objectives to address this emerging threat. And what we'll do with regard to the public is make sure that we create transparency. Because the more we can inform the public about what we are seeing and what we are doing, you'll better be prepared to achieve that, not overreacting or not underreacting. So in the coming days, what you're going to see is a lot of daily activities. So each day at 10 o'clock, we have a virtual coordination call with what we call our operations working group. And that is the school system, our Department of Human Services, our law enforcement community, our emergency services, to go over and work through issues, complex issues that come up. This is not going to be a short-fused event. We don't know when this is going to end. So we need to think about what we're going to need down the road. And so we have this working group that will be working every day at 10 o'clock on a call to work these issues. The second group we have in our community is a business and private sector information call that we do on Tuesdays and Fridays at noon. And this is so our community can come together and get real-time information, but also to share concerns. We recognize that the private sector in this community, as well as all communities, are a driving force. As a matter of fact, we're pretty excited about some of the things that our private sector, our business community have already done on their own. They've taken these CDC recommendations and other recommendations, and they're beginning to institute them for the public safety. So we're going to make sure that we have those meetings on a regular basis. And then the final thing is we have a joint information group working. A joint information group are representatives from each organization that is working this issue. And they come together so that we can send a common message out, a comprehensive message to the community so we achieve that transparency.
We're looking at a child care sheltering program for essential and critical and mission critical employees. The school system was going to play a major part in it, as well as with the Board of Health. And to that end, I would like to bring Superintendent Kelly Griffiths up to say a few words about the child care sheltering program and how that's going to work using some of the space that's available to her.
Before talking about the sheltering of children, let's also talk about make sure our children are being fed, if I could, please. So one of the things, we have an amazing community and amazing community partners and volunteers. So what we're going to be doing is we're going to be feeding students, any children from ages 2 through 18, every day between 9 and 11. They can come to Easton Middle School or St. Michael's Middle High School and pick up a breakfast and lunch during that time. Each day of the week, and on Fridays they will also get a care pack for the weekend with enough meals for the entire weekend for all of the children. And if we do have some folks that need some home delivery, we're going to be contacting some folks to see if we can do that as well. We've been working with our partners like Talbot Mentors, CASA Workers, BAM, Chess MRC, so they're reaching out to their community as well to make sure everyone's well informed. And so we will be doing that, and then we'll be opening the Head Start building at Easton Elementary School behind the Dobson building, and that will be one of the places where we do school-age shelter in place for children of critical essential employees, and then the early Head Start on Bay Street. And we will also be providing meals for those children as well. And I'll let Dr. Wadley talk a little bit about more structure that she's going to be staffing both of those centers and we'll be feeding. But we're also working on registration and a needs assessment. So there's a lot of things going on behind the scenes, but we're going to make sure that we're taking care of our community. It's very important.
But we do need to know a number, the ages of children that will be attending. So we'll be announcing so that parents will know who to call and how they will apply for their children. As we said, the estimate we need is just to know how many rooms and all and how much staff we need. We have our school nurses that, because the schools are closed, can help us with that. Because the Early Head Start was closed, we have our staff already there to help with that. And we've had some really good volunteer opportunities. So We don't believe we'll have any problem with that. We're just working through the difficulties of how to set it up, and hopefully we'll have it by Wednesday, but there's still a lot to do before that happens.
Thank you, Doctor. So, okay, so Clay has a few more things before we close it out and take any questions from the media.
I just wanted to say that we're going to be in Talbot County spinning up a website that's clearly just for the coronavirus, and it's going to be talbotcovid19.org. And then we also want to just point people to a couple websites, and that's the Maryland Department of Health, Talbot County Department of Health, and CDC websites. Those are our credible sites that we're trying to direct people to. So we would appreciate you sharing that information with your viewers and listeners and readers. So again, thank you very much.
Okay, and we'll take a few brief questions. If there's anyone from the media who has a question or two regarding.
What advice, if any, are you giving to businesses?
The individual is currently still at the hospital here in Easton. I don't know when exactly the test was performed. We received the information earlier this morning.
Because, you know, initially only CDC in Atlanta did the test. Then our lab in Baltimore, our state lab, came online. And then private labs came online, LabCorp and Quest Diagnostic. The choke point there, though, is that someone needs to take that swab that runs down from the nose to the throat, put it in viral media, and then wrap it accordingly to ship it to the lab. And that's very complicated. And so there hasn't been as much testing as we'd like to be, and we're working on that, okay? But it is the limit of that viral media that has really sort of slowed the testing that we'd like to get over. But yes, now private labs can do that, and we're urging private physicians to take those samples and send them to the lab so that will increase how much we can test and not just depend on the state lab, which we want to reserve for those cases that we really believe are positive and need to get out rapidly.
And your county is working collaboratively to bring this information to you as concisely as we possibly can, making sure that we give you accurate, complete messaging. Again, go to those various websites, as Mr. Stamp mentioned before. You can click on those tabs, talbotdes.org currently right now to get any updated information on the COVID-19 efforts here in Talbot County. And then once the Talbot County COVID-19.org site comes online in approximately 2 days, you can go right onto that site to get information that you need to keep you and your family safe.